Hi there, this is Dr. Stuart Yas from Bannockburn Chiropractic and Physical Therapy. Today, again, I'm still here with Alyssa with an I, Lasky, from Obsidian Counseling and Wellness. Today we're going to talk about nervous system and the nervous system regulation and how the nervous system really plays kind of a role in our general health. And so, give a quick anatomy lesson. We have two nervous systems. The main one that everyone knows about is the central nervous system. That's the brain and the spinal cord that comes off the brain. Obviously, the spinal cord comes and then gives off the nerves that go to every organ, tissue, gland in the body. Within that, then we will have the autonomic nervous system. We have the sympathetic nervous system and the parasympathetic nervous system. The sympathetic nervous system is what we call the fight or flight, and parasympathetic is rest and digest. So when we're constantly under stress, our sympathetic nervous system is constantly going, and we're going to start to see symptoms like elevated heart rates, increased blood pressure, shallow breathing, things along those lines that you notice like when you're scared. Your autonomic or your parasympathetic nervous system, the rest and digest, is kind of when we're chilled. So we're going to have a lower heart rate, more deep, full diaphragmatic breathing that we talked about last week. Things along those lines. That's where we're going to start to chill. We're going to see changes with our pupils. It really impacts every part of our body. When we have our sympathetic nervous system also being stressed, it impacts a certain hormone called cortisol. That's kind of the stress hormone. And when we start to see elevated levels of cortisol, we have different body reactions. One of the most common and most frustrating one to just about everyone is weight loss or the inability to lose weight. And a lot of times the spare tire that we have around here, a lot of times is related to the cortisol levels. So if we can kind of get those levels balanced out, a lot of times we can finally lose those 10 pounds that we're, as much as you try to exercise that you can't lose. Sometimes getting those levels under control really can make a difference for us. So that's just kind of a general quick anatomy lesson for you and how that impacts our general health. Now, what can you do to kind of help work with the regulation of the nervous system and our health? Again, in our office, something that we mentioned last week is that app NewCalm, because as we can try to downregulate that sympathetic nervous system, again, using that pericardium 6 spot, that downregulates the sympathetic nervous system, again, allowing our bodies to relax. So that's kind of like one way, again, that here in our office that we deal. Sometimes with diet, that can play a factor as well. So diet modification can help lower cortisol levels. But I'm gonna throw it to you, Alyssa. And
I was just thinking about, you were talking about down regulation, which is really interesting because sometimes, so taking a step back, what Dr. Yas was saying is we have those two systems, and in mental health, sometimes the sympathetic nervous system gets a bad rap. And there's nothing inherently wrong with it. But like Dr. Yas was saying, if you get stuck there and you're there for a long period of time, then that can be really challenging. But the idea is that they can work in harmony, that you can be regulated within your nervous system and respond to a threat and then come back to some sort of equilibrium state.
Correct, right.
And so sometimes what happens if there's activation and you get stuck in that sympathetic nervous system, you can appear stressed, anxious, and high on the nervous system regulation. So you need to come down and to regulate back to equilibrium. But sometimes actually you get stuck in a freeze state, which can look like apathy, depression. There's a lot of different ways that shows up. But in that sense, you'd actually have to upregulate to find that equilibrium state. And so I wonder if there's anything that NewCalm does to help with something like that, because those are the two things that I think about. Is it's almost like in my mind like a highway, and there are these 3 lanes, and you can move from one to the next but I want you to spend a good chunk of your time in that middle lane.
Well, hopefully we're not talking about the Edens right now, because we're going to be stuck in one lane for a long time.
That is true.
Well, with Newcom, you actually can. I mean, really, the idea is to create balance and harmony.
Cool.
And again, as I was saying, and as Alyssa was saying, you don't want to be all the way only in one of those. You definitely want to move from side to side, depending on the situation.
Yep.
For instance, obviously, as we were preparing for today, I felt my heart rate racing, and knowing that my sympathetic nervous system was starting to kick in, as much as I was trying to press my pericardium 6 to get parasympathetic. But you want to kind of keep moving and kind of ebbing and flowing and moving from back and forth from one to the other. And again, that's going to allow our bodies really to overall heal, because that's one of the things that we see in my office, and really how we started to develop this relationship is, when I have a patient that isn't responding to care. I know that if a low back pain, if I know what the diagnosis is and I find that they're not healing as they should, that's when I may start to investigate. A lot of people know Dr. Sarnow, who's out there, who he really talks about the connection between the physiological or the psychological and the physiological body. So again, he's someone who's well known. But we see it every day in our practice of how people who aren't responding to care, it may be that they have a lot of that stress. And a lot of people even joke with me like, "Oh, you play part-time therapist as well."
I'm sure you do.
I do. I'm like, oh my God, I have all this pressure. I'm taking them at their physical, their emotional, as they're telling me their life stories.
Yeah.
One of these days I'm going to write this fantastic book, just with all the different stories that patient, purely anonymous, it won't break HIPAA, I promise. But it'll have all these, great stories that people tell me that they deal with. So we see it every day in how our patients are responding to care or not responding to care. And that's really where, when I see they're not responding, when I may start probing and going deeper into what's going on in their lives to see if that's playing a factor and how we see that. And I'm sure you probably see it on your end of the spectrum.
Absolutely. Interestingly, your perception of your ability to predict and or control the stressor can be pretty impactful too. So I think about that, like, how do I think about if my son is going to run into the street, which he has done before? How do I think about it? Do I feel like I have something that I can do in this situation? And that moves my nervous system in a lot of different ways. But if I get stuck in that stress state, then that can be really, really impactful on my physical and mental health. And so, talking to somebody, I think, is a great option. But what we'll talk about in our next video is actually EMDR, which we'll say that for the next time. But that can be helpful too for regulation of the nervous system, but specifically helping with traumatic experiences.
Great. Well, hopefully you found this week's video interesting and informative. Again, if you ever feel like you need to reach out to us, please feel free to reach out to me, Dr. Yas, 847-236-1194 at bandchiro.com, or
you can email me, Alyssa with an I, at obsidiancounseling.com. You can find us on our website, obsidiancounseling.com. Or you can call me, 224-255-4411.
Thank you and have a great day.